In this module, we'll be covering the new telehealth item numbers that are now included in the MBS. The introduction of these item numbers has been fast-tracked due to the COVID-19 pandemic crisis. When these item numbers were first released, there were quite a few limitations on who could access these item numbers. However, as of the 30th of March 2020, telehealth services are now available to all Australians. So access has been significantly increased, and we are now seeing many consultations that traditionally would have been a face-to-face are now carried out via telehealth. So what is telehealth, also known as telemedicine? Well, Wikipedia's definition is telehealth is the distribution of health-related services and information via electronic information and telecommunication technologies. So it's part of the new e-health or digital health space. There are a wide range of different technologies that we can use for telehealth, but in the simplest form, it is literally picking up the telephone and speaking with a patient. With regards to the telehealth item numbers, the preference from the Department of Health is the ability to use video for these consultations, but they will accept audio because of the need to rapidly deploy telehealth item numbers. The item numbers are broken up into two primary groups, one set for telephone consults or audio only, and the other for video consults. The rebates for both groups are the same, so there is no difference in income between a 15-minute telephone consult and a 15-minute video consult. And the rebates are paid at 85% of the new item fees, but they have adjusted the fee, so the amount paid will be equal to the amount you would get for an equal length face-to-face consultation. Like face-to-face consultations, telehealth consultations are also time-based. The consults need to be live and in real time, which means remote patient monitoring via some form of technology or store and forward services where you would have the patient take a photograph of a skin condition and then send it to you for an opinion are not included. These item numbers don't include asynchronous channels, so you can't claim an item number for chatting to a patient over email or SMS. Note though, if you have the patient send you a photograph of a skin condition and then follow up with either a telephone or video consult, you can access these item numbers for the consultation component of the process. These item numbers are available to all GPs and other medical practitioners, for example, non-VR GPs, specialists, nurse practitioners, midwives, and allied mental health providers. Please note that at this stage the item numbers are temporary and have been put in place for 6 months. At the time of this recording, which is in April, the item numbers are set to expire on the 30th of September 2020. Hopefully, we will see this extended past the September cutoff. When it comes to video consults, there are a number of platforms that can be used. The department has listed platforms that can be used, which include Zoom, Skype, FaceTime, Duo, and GoToMeeting. However, check the video services that you have signed up for your telehealth consults meet the applicable laws for security and privacy. It is also okay for a health practitioner to conduct telehealth consultations from home. If you are working from home, you would simply use your provider number from your main practice or your primary practice. You can use telehealth item numbers more than once for the same patient on the same day, and you can see a patient for a telehealth consult and then a face-to-face consult on the same day. But you need to be clear with documentation, and you need to include the time of each consultation on the patient's account or bulk billing voucher. They do stipulate that it can't just be a continuation of the same condition. An example would be you're consulting with a patient on the phone and get disconnected. For some technical reason, you don't get back in touch with the patient until an hour later. You can't charge a second telehealth item number for the second call, as it's a continuation of the first consultation. But you can combine the time from the two calls to work out which item number you're going to charge. I strongly recommend good clinical records for these telehealth consultations. We don't know what the auditing process will be like at the end of this, so be very careful about your documentation and always cover yourself by ensuring that you have met the conditions that have been stipulated by Medicare. There were some concerns from people about how to get consent from the patient to assign their Medicare benefit to the practitioner. So if you read Medicare really carefully, it tells you that you have to send an email to the patient and get them to sign something to say that they are happy for you to receive the Medicare benefit on their behalf. It now appears that after realizing how challenging this process is, they've come back and said they will accept verbal consent. So when you're doing your consultation, ask the patient if they are okay with assigning the benefit from Medicare to you, as you are going to be bulk billing this telehealth consult. And then as long as you have this consent documented in the clinical notes, Medicare are happy to accept verbal consent. Initially, the requirement was that all telehealth item numbers had to be bulk billed. However, from the 6th of April 2020, the rules changed so that the requirement to bulk bill the new telehealth services was limited to Commonwealth concession card holders, children under the age of 16 years old, and patients who are more vulnerable to COVID-19. Health providers may apply their usual billing practices to the telehealth item numbers for patients who do not fit this criteria, meaning you can privately bill them. You are expected to obtain informed financial consent from patients prior to providing the service, which includes any out-of-pocket costs. And when billing the patient, you charge them the full amount and the patient claims back the item number from Medicare. So here's the criteria that determines if somebody is at risk of COVID-19 virus. They are required to self-isolate or self-quarantine. They are at least 70 years old. They identify as being Aboriginal or Torres Strait Island descent and are at least 50 years old. They are pregnant. They are a parent of a child under the age of 12. They are being treated for a chronic health condition, or they are immune compromised, or they meet the current national triage protocol criteria for suspected COVID-19 infection. So you can see this is still quite a few patients that will need to be bulk billed when having a telehealth consult. When we look at the descriptors for these new item numbers, we find the item numbers for the general practice telehealth consultation are very similar to the face-to-face consultation descriptors. A short consult is not time-based. There simply needs to be an obvious problem characterised by the straightforward nature of the task that requires a short patient history and, if required, limited management. Standard and long consult item numbers are time-based with the same time increments as level B, C and D face-to-face consults. So up to 20 minutes to 40 minutes and greater than 40 minutes. And the consult needs to include any of the following: taking a short patient history, arranging any necessary investigation, implementing a management plan and providing appropriate preventative health care. As I noted earlier, there are one set of item numbers for video consultations and one set for telephone consultations. This slide represents the most commonly used item numbers for video telehealth consultations, noting that these item numbers are specifically for vocationally registered general practitioners. And these are the set of item numbers most commonly used for telephone telehealth consultations. There are actually 222 items within the new telehealth MBS space. The item numbers are first split based on how the consultation is provided, being telephone or video. The items are also split by the type of health practitioner providing the services, and they are also split again by the health issue the health practitioner is dealing with. As you can see, this list includes non-vocationally registered GPs, mental health treatment plans, GP management plans, health assessments, pregnancy support, eating disorders, and after-hours appointments. Further details on these item numbers and detailed descriptors can easily be obtained from the MBS website. I do think we will see changes in how these item numbers can be used, especially when we get closer to September. So keep an eye on this website for any updates that may be released. And you're more than welcome to shoot me an email with any questions that you may have on these telehealth item numbers or any other Medicare item numbers. Thank you very much.